Recent years have seen a rising trend in the number of referrals of children to social care. The numbers make for uncomfortable reading. At a national level, the number of referrals now equates to nearly 4,000 per local authority. In the year to the end of March 2012, there were over 600,000 referrals. 168,000 children were identified as being in need because of either abuse or neglect, and more than 52,000 children became subject to a child protection plan in that year alone. The cost of child maltreatment is high and impacts at a national level, now and in the longer term. Research has highlighted the considerable pressures the activity places on resources, with figures stretching to many hundreds of millions every year in terms of social care and health alone. It took high-profile cases to highlight child maltreatment as a national issue in the public eye. In autumn 2008, media reporting of the death of baby P, Peter Connolly, and the publication of the first serious case review sharply highlighted failures in inter-agency working, as well as shortcomings within individual agencies. The Monroe Review of Child Protection and the government response has had a major influence on the direction of child protection policy and practice. It recommends a radical reduction in the amount of central prescription of processes and timescales. The Monroe Review recommends a duty on local authorities and statutory partners to secure sufficient early help services, and that children and families should receive this early help where their needs do not meet the threshold for children's social care services. Critically, the review makes the case for a multi-agency approach to early intervention and prevention. The importance of strong inter-agency working and information sharing, as well as the need for each profession being trained in safeguarding practice and the indicators of child maltreatment, has been emphasised across the board in published standards and professional guidelines. The obstacles to inter-agency collaboration between health and social care have been extensively researched and documented. Key barriers include different professional approaches to and perceptions of child maltreatment, a lack of shared understandings of thresholds, a reluctance to act if the signs are not clear-cut. There are also uncertainties and confusions about information sharing and confidentiality, difficulty keeping up with guidance and training, as well as fears about challenges from parents resulting in accusations of malpractice and litigation. There's poor communication between individuals and agencies and lack of clarity about the roles of different professions, misunderstandings and mistrust. It's against this backdrop that Skye, as part of the programme of work of the Policy Research Unit in the Health of Children, Young People and Families, has produced a report. It's called Partnership Working in Child Protection and is a study of how acute paediatric and local authority statutory child protection services work together in cases of suspected child maltreatment. The report distills examples of good practice from across the country and includes a framework against which trusts and local authorities might together assess and strength test their approaches and provision. It looks at communication and availability, where core groups of individuals, whether based in the trust or locality, lead on liaison between the two agencies, working through regular meetings and networks, organising joint training, supervision, peer review and audits. Good practice is reviewed in the identification of cases where child maltreatment should be considered, including holistic approaches to the understanding of safeguarding, sharing of information, and importantly, how awareness is made amongst professionals of early intervention services and help. How agencies build a common understanding of the thresholds for referral to social care, processes and practical systems for the sharing of information and feedback. The report looks at pre-birth planning, specifically how agreements and shared understandings are ensured on the point at which pre-birth referrals are accepted and pre-birth plans agreed. The issues of admission and discharge, where processes are reviewed and examined, including clear procedures for the involvement of social care and senior clinical and/or safeguarding staff in decisions. In addition to the report, 2 case studies have been filmed in which practitioners describe how they are achieving success through interagency working. The report stresses that success in child protection relies not only on investment and commitment to collaborative working, but also the organisational vision and values. Different models can therefore achieve similar results, as illustrated through the case study films. A strong message from the research is that building and sustaining a partnership approach to child protection requires investment. It requires a shared vision, as well as systems and structures to articulate that vision, ensuring that as we look to the future, clear, measurable steps are being taken to protect children from harm.